Today we will be discussing, just watch.
In this video, I will cover postpartum hemorrhage, commonly known as PPH. If you want to support this channel and see more videos like this, please like and subscribe. Don't forget to hit the bell button to be notified when a similar video is posted. Let's get back to where we were. Postpartum hemorrhage is defined as blood loss of 1 liter or more after delivery, whether vaginal or cesarean section. Compare that with the old definition, which was 500 milliliters after vaginal delivery. It can be further classified into primary if it happens before 24 hours after delivery, or secondary if it happens after 24 hours. In this video, we will mainly talk about primary because it is far more common. To remember the causes, we will think of the letter T. It can be due to tone in case of uterine atony, trauma that can involve the uterus, cervix, vagina or perineum, tissue for retained tissue such as placenta or membranes, and the last T is for thrombus, which includes bleeding disorder like DIC or disseminated intravascular coagulopathy. The most common cause of primary PPH is uterine atony, so it's worth spending some time to think about the risk factors. The first one is overdistension of the uterus in case of twins, polyhydramnios, or microsomia. Second is prolonged labor and the use of oxytocin. And lastly, drugs like tocolytics and halogenated agents that are used during general anesthesia. 6 steps are used in the management of postpartum hemorrhage. The first one is calling for help because it's an emergency. It's important to alert the anesthesia team in case the patient needs to go to the operating room, another colleague who can help, and the hematologist in case the patient needs blood products. Second is assessing airways, breathing and circulation. That includes giving oxygen, securing an intravenous line, starting intravenous fluid and sending blood for testing. Managing postpartum hemorrhage should be a team effort. While giving instructions to other team members, the team leader can perform other steps to help the uterus contract in case of atony. That includes uterine massage, bimanual compression, and inserting a urinary catheter. It's important to think about the possible cause of PPH while those steps are taking place. In addition to oxytocin, which is given routinely after delivery, the medications used to treat postpartum hemorrhage include methogen, which is contraindicated in case of hypertension or preeclampsia, hemabate, which is contraindicated in case of poorly controlled asthma, misoprostol, which can be given rectally, and tranexamic acid, which is an antifibrinolytic drug. If those measures don't help and the uterus is still atonic, tamponading the uterus can be attempted by applying pressure from within. That can be done by inserting gauzes, specialized types of balloons, or multiple Foley catheters. After inspecting for trauma and making sure that the uterus is empty, if the previous measures do not stop the bleeding, it's important to take the patient to the operating room. After laparotomy, uterine artery ligation can be attempted, or compression sutures can be applied. As a last resort only, a hysterectomy should be performed.
For videos like this, like and subscribe.